And today, Dr. Tom and Karina Lozano, surgical liaison, will talk about SmartLipo. Welcome, Dr. Tom.
Thank you, Michelle. Are you staying cool?
I'm in air-conditioned building right now. I'm afraid to leave it.
When we came out of the outside, oh my gosh. Of course, you are in charge of the news here on KSRO.
Yeah.
What is the forecast for today?
Well, it's going to be pretty hot. So if you're up in the mountains, it's going to be a little bit hotter, up to 110 degrees.
Oh my gosh.
Yeah, and we've got this warning going on. It expires on Friday at 8 p.m. So we're just going to have to deal with the heat for at least the next 2 days.
All right, so stay cool out there. Stay cool, Sonoma County. All right. Well, thank you, Michelle, and thank all of you. And again, we want to thank you, listeners, for check in with us every Thursday at 12:30, and we want to thank you for voting for us for the Press Democrat Best Cosmetic Surgery as well as Aesthetician services. We really appreciate it. Thank you so much. And we have Karina back. Karina is just a regular now. Karina, why don't you introduce yourself to the listening audience?
I'm Karina. Thank you for having me back.
Okay. And Karina, what do you do besides sounding great on the radio?
Oh, I hang out with you all the time, keep you on time. No, I'm kidding.
Okay, you do keep me on time.
Surgery
That's true.
Scheduling, assisting in surgery, and then medical assisting.
That's
for the
right.
Office.
So you really are. You indeed. The listeners who check in with us every week, you know, you are my Radar O'Reilly. And Karina's so young she doesn't even know who Radar O'Reilly is from MASH, but indeed that's who she is. So Karina, you now have taken over a very important position in the office. You're our surgical liaison. So if you're interested, like for instance today, our listeners, and you've listened to us talk about SmartLipo, you have some questions, first thing you should do is just give us a call. There's absolutely no pressure, and they will set you up with a specific phone consultation time with you, Karina, right? And you'll do an intake with them and chat with our patients, and then set up ongoing consultations with myself and bringing them into the office. So today we're going to be talking about, in this heat, what are you going to do with your kids this afternoon? You told me.
We're going to go swimming.
You're going to go swimming, okay. And so because you're going swimming, you're probably put on your bathing suit, right?
Yes.
All right. And so now we're kind of definitely into bathing suit time. And so as with all of us, we're kind of looking in the mirror, and as much as we can love ourselves, we go, oh God, I had too many burritos the other night. And so we start to look at our bodies and kind of want to, could I do a little tweak here and there? And so, they are thinking about, well, is there something I can do? So tell me, when someone calls up about SmartLipo in the office and they set up a phone consultation with you, how does the conversation go? What are their concerns? Why are they calling us?
So usually it's women, but we do have some men that call.
We
for
absolutely
SmartLipo.
have men.
Yeah,
We
men
absolutely
want
do
to
get
look
men
great
calling.
as well.
Right.
And they're been working out, or they say I'm healthy. I've had this increase of fat around my stomach and it just can't seem to get rid of it, or I've had some weight loss and there's still some areas that are troublesome. So
So they're noticing kind of around their abdomen. And do they complain at all about the back, what we call the flanks, which would be the waist and going to the back, or what the kids call the muffin top? Do many people talk about that for you?
I don't think that it's an area that people see as much. But once we start talking, there's always that suggestion of, if we're treating one area, let's make the whole area, everything look better.
Everything look better.
Yeah.
Right. So they're calling you about that. And what I've seen when you refer them, the patients, to me after you have your phone consultation with them, Karina, is that there's two subsets that stand out to me. One of them are the women who are 45 to 55 who are perimenopausal, and they feel like, hey, I've been pretty happy with myself. I eat healthy. Not everybody has to run a marathon or they have to be a vegan, but they just, they feel like they're being pretty healthy, and then all of a sudden, boom, hormonal changes and all. And now they're noticing this change in their body. That's one subset. And then the other subset is women who have had babies, and they're coming in and they've noticed changes because now they're mommies, right? Okay. So do they, when they come in or when they call you, Karina, do they just right away say, it's about my belly or about my muffin top? Or is it usually related to how they're feeling at home? Is it to events? What kind of concerns do patients have when they actually have the courage to call us about maybe doing SmartLipo?
I think most women go straight to the belly. I think that's just an area that we see. I myself see fat that is gathered there just from eating too much good food and drinking too much good wine and enjoying all the good food.
Enjoying the life of living in the beautiful wine country that we do, and I would agree. And although I said perimenopausal, there's also perimenopausal, because I definitely, being a baby boomer, feel like I've gone through some menopause in terms of hormonal changes, and even though I tend to be slender for most of my life, I'm definitely putting on a little bit of a pooch here, and so I'm gonna have to teach you how to do SmartLipo so you can take care of me. Okay, alrighty. So let's talk about SmartLipo a little bit. So when they call you and they say, I'm unhappy with kind of my tire around my abdomen and so forth, and I want to approach that, what do you tell them about the procedure that we can offer them?
So I kind of go through a process of elimination with them.
Okay.
So I want them to say, okay, so we go, well, when you look at your stomach, do you feel like it's more fat or looseness of skin, or a combination of both?
Okay.
And more, that's kind of helping me rule out if they might be a candidate for a tummy tuck as well. And or if they would just be a candidate for lipo to reduce the girth of the belly around the abdomen.
Okay.
And so most women can say, oh yeah, no, there's a lot of fat there. Someone go, oh, I've had kids and I think there's some looseness. So that kind of helps me guide the patient in either or direction. And then of course photos. We always ask for some photos of the area for you to review.
Right, and that makes a real big difference. So I thought, and I've related to this to the listeners in the past, when COVID came around and we were going to all virtual consultations, I didn't actually like it. I always mentioned that I like to kind of bond with the patient and really get to know them and examine them right away. And now it's just become industry standard where I think the patients enjoy doing a virtual consult as much as secure an environment as we try to provide in our office. I think we forget how intimidating that is for a patient, a woman, to come in and to expose an area of their concern. Okay, and in fact, a lot of times, just from an emotional standpoint, what really touches me is when I have a patient, and they tend to be more women, who say, I won't even get disrobed in front of my partner because they're so self-conscious. Okay. And it amazes me that they are willing, thankfully, to take photos. And so a lot of times we'll tell them, keep a bra on or put a two-piece bathing suit on, take photos, or maybe a sports bra and some real short shorts or whatever, and then take photos, a front view, 2 side views, and if they can figure it out, take a back view. Are there any tricks for taking those photos if they're on their own? They don't want any, the last thing they want to do a lot of times is have their partners take photos. So tell me, what are the tricks for taking photos?
I have guided people through this before.
Okay.
Find a good spot in the bathroom. Usually there's counter space. Prop up your phone.
Okay.
Put it in selfie mode and use that good old timer.
There you go.
Yeah.
Okay.
And that usually helps out.
Right. Exactly. So use the timer. You take the photos, and so they send them in to you, and then you'll review them with me.
Correct.
Okay. And so then we decide if they're an appropriate candidate. So let's talk about patient who's put on some volume of fat around the abdomen, around the belly button, and the waist and the muffin top area. So we'll set up that consultation. I'll review the photos with the patient. What's always sort of, again, kind of from an emotional standpoint that hits me is that I'll have patients tell me that they just no longer feel feminine. Okay. They're self-confident, they love themselves, but they're just feeling like that's a change that they don't like. And as much as we would like to think, hey, it doesn't matter, for a lot of us it still does matter how we feel about ourselves, how we fit in our clothes. In fact, most women will tell me it's not that they necessarily want to look their best in a bathing suit. I mentioned that at the beginning of the show, but they just want to look better in their clothes. And so they talk about their abdomen and their muffin top area. So as I'm talking to them, Karina, and you're thinking about when we're in surgery together and taking care of them, what are there certain areas where you think that the patients get a real big bang for their dollar?
Yeah, I would definitely say that the area that they don't think of, which is the muffin top or that area,
Yes.
is usually an area of high satisfaction for the patient, where they're very content with it.
Absolutely. So when we approach somebody, you want to look at them globally. So we don't necessarily need to have you send in photos of your face showing, but we really want you from maybe the chin down to your knees, because you want to look at the entire person. It's just not one little segment. And a lot of times patients will focus on, I don't like the abdomen. I that's what I'm focused on. And what they don't see is that continuation of excess volume or fat that wraps around their waist to their backside. And that actually takes away from their femininity even more so than that frontal fat accumulation. So that's an area that when we show them the photos, and then we show them a lot, I mean, I have hundreds of before and after photos of our patients to share with them on Zoom or on a virtual consultation. They can see what a difference it makes when we reduce the sides of the waist as well as that back area. Of course, we're going to be very aggressive about reducing the volume in the front, but taking care of that waist and that back area, I get super excited about that area. You know that.
Yes.
Okay. So you've seen that in patients?
Of course, yes.
Okay.
Yeah.
And so as I'm going through, Karina, the kind of discussing the indications, why we might do it, the benefits, alternatives, and potential risk of doing this, when I discuss it with them, I'm telling them, yes, I know your primary concern is the front of your abdomen, but let's look at you globally, so 360 degrees with the photos you've been kind enough to send us. And I explained to them that if we don't work on that backside, they're not going to be as happy with the results. And it's not that I'm trying to upsell them and make them do an extra area, but I know that they will be knocking on the door and want to get back in to have that area treated as well. So there is a price break when you do more than one area, so we try to help them to ease that decision for them, and we treat sort of 360 degrees around their back. Okay. Is there anything, so if they're a good candidate for this and we go ahead and we schedule them, is there anything specific that you kind of advise the patient ahead of time for the surgery?
Just maintaining, if they're working on their weight loss, keep working on that. Just a healthy, active lifestyle is usually best for recovery. If you're doing it during the summer, just stay nice and hydrated, because it's getting towards the time where people are dehydrated.
Yes.
So just keep taking good care of yourself is usually
good. And I like that how you put that, Karina, about just taking good care of yourself. So there is some denial on all of us, and I am guilty of that as well, especially a lot of times people say, well, I don't weigh myself, and then so I kind of know they're probably heavier than they think they are. And I go through that same thing with myself in the morning, like, oh, I'm not going to even weigh myself, because I know that I had way too much food the day before, okay? And so I even am guilty of that. But what I tell patients is I don't want you to go on a crash diet, okay? We don't want you to be in at a status, your body physiology status, where you're breaking down your own tissues. We want you to be in a building up and in a building up way. So the breaking down is called catabolic, and the building up is called the anabolic, where you're building up. That doesn't mean that we want you to go out and to be eating in excess, but we want you to be eating healthy, to not be doing crash dieting beforehand, because we want your body in a, I'm ready to have a procedure and I'm ready to prepare for repair. I'm ready to prepare for repair. Okay, and that's important to do. So we help them, we educate them on that, and so they come in and do the procedure. Can you tell a little bit about what the procedure is like in terms of what we do in the operating room?
Yeah, so you are awake, so that is what we do.
Right.
But we do give you some medication to help calm you down, some oral medication.
Right.
And then you will feel a little bit of pinpricks in the areas while you're numbing. Your Dr. Tom will be numbing you. So there is a little bit of discomfort to begin with, but not too much. Most people are actually pretty comfortable.
Right.
They're kind of sleeping away.
And they're getting a head massage by Heather, who's our lead OR nurse, and so we got this down. Head massage, a bed warmer,
good calming music.
Good calming music.
Although we did have that one patient, and her calming music was soft rock.
Oh, I don't think her calming music was soft. I think it was hard rock. I was having flashbacks to my college days. I mean, we were rocking out to 60s 60s and 70s music.
Yeah, she was definitely calm.
Yeah, it was great for me. I was loving
Yeah.
it, but she was calm with it. So whatever fits with the person,
Of
okay.
course.
And so we do this under local, as you said. And once we do that, then we go through certain maneuvers where and you're not feeling this at all, but we're emulsifying the fat. We're using the laser to melt the fat. We're actually using the laser more under the skin to give us a smoother result, and that's the smart part, smart lipo, okay. Smart laser lipo, we should call it. And then we do suction the fat in the areas of concern. So we do that, and as we're doing that, Karina, you know you're participating in the procedure with me, and we're looking at the body as a whole. What are some of the things that you've noticed about me while I'm doing this? We didn't discuss this, by the way, everybody, ahead of time. I'm kind of throwing these new things out at Karina to keep it fresh. Is there anything that you notice that I'm doing during the procedure to try to give the patient the optimal results?
We're definitely stopping a lot and evaluating as we go. It's not, we don't just keep working and then we're done. So you definitely evaluate the areas, make sure that we're not leaving them with unevenness of the stomach. We don't want them to be unhappy because now they have too much fat taken away in certain areas.
Right.
So yeah, definitely evaluating as you go for the patient.
Right, and I think the key here is that we just take our time. What's nice about doing this under local is that your recovery is so much quicker. There's gonna be a couple days where you're probably hanging around the house, even though I've had people go out for walks the next day. What I tell people is when you go home, I hardly ever have anyone tell me they're uncomfortable. But actually, because of the long-term effects of the local anesthesia, which lasts hours and hours, that they're feeling pretty good. Maybe by evening time they might need to take some pain medication to kind of get them through the evening. In the morning they wake up and they're kind of thinking, wow, I made it, even though I might trust Dr. Tom and Karina, I was nervous, and that's natural. And they wake up in the morning, I made it, this is great. And then they get up and they go, whoa, all right. And I tell all the patients, you're going to feel like you've worked out harder than you've ever worked out. Even though we've done nothing to the muscles, you have no big incisions and all that. It is just because it is still a procedure that we've suctioned the fat out that you're feeling uncomfortable. But you have a garment on, okay? And a lot of the local anesthetic that we injected is draining out, and that's important because we want it to drain out so that you have less swelling afterwards. But you're up and moving about, and I'd say maybe half the patients take pain medication, Karina, about the other half can take acetaminophen or Tylenol for pain immediately afterwards. So it's pretty well tolerated.
Yes, most people tolerate it very well. They're not in an extreme amount of discomfort.
Yeah, I would agree. I think they actually do really, really well. And so I'm going to get a little techno nerd on us here, audience. So we use a lidocaine local anesthesia, and it is what we call fat soluble. It's absorbed into fat. And so we're injecting it into your fatty layer to suction out the fat that we don't want. So what happens is that lidocaine then adheres to your fatty tissues and it stays there longer. That's why we get such great anesthesia when we inject it, and why it can last a good amount of time for you. So that's one of the major advantages of doing SmartLipo under local anesthesia. So we do that, and what do you tell them afterwards what to expect?
I usually say, and this is what people tell me, I just feel like I had the most intense workout. Where they're very sore. So lots of resting, allowing your body to recuperate, lots of hydrating yourself. Get yourself nice and hydrated for that, and then just have someone to stay with you and help you throughout the process of the first 2 days that are most uncomfortable.
For a couple of days, and that's what I would tell patients, and I'm constantly saying this to patients, Karina, thank you for mentioning it, is that give yourself time to recover. If you set aside time, have someone be there for you. I know everyone's too busy. I don't have anyone. Oh, I've got to go to work the next day. All these things, we hear it all the time. But if you give yourself a couple of days to recover, your recovery will be so much quicker in the long run. So please, please, please make sure if you come in and you work with us that you arrange to have somebody help take care of you for a couple of days. You might as well, you deserve it, right? And just take it easy for a couple of days. All right, so in terms of results, I tell patients when they look in the mirror is look at the mirror right away the first day or two, okay? And you're gonna say, wow. You're gonna say, oh my God, I have a waist, or I didn't really put much on what Dr. Tom was talking about, the waist and the muffin top area, but oh my God, does my butt look good, right? Because you're kind of removing that fat layer above it, and it just makes it look great. Then what happens after those 2 days, though?
Then the swelling comes in.
Then the swelling. I'm going to apologize. I'm going to cough here a minute.
Yeah, you're swelling, and that's why we have you wear that surgical garment to help keep everything nice and compressed.
Right, so you're going to swell up, and you may say, geez, did it even take anything off? So I always want the patients to look right away, first 24 hours, 48 hours, because that's going to give you a good idea of the results you're going to have.
Well, motivation.
Right, absolutely. And then the body swells up, and you do wear a garment, and we're going to have you wear it from anywhere from 2 to 6 weeks to improve the results, and compression wrap you to give you your best result.
Right.
Okay. So patients come in, and we did a patient on Monday, and we saw her on Wednesday, and she was doing great, and she noticed right away. And it is amazing. So people might say, oh, they specifically have a complaint. I don't like my belly fat, or I don't like my muffin top, or whatever. I like to think more globally, looking at people. And when I saw her walk in, she just looked younger. Okay, she's a baby boomer. And when she came in, she just looked younger. And it's just making some of those changes that occur that made her look better. And she was very, very happy with the results. Another area that we worked on, do you remember what other area we worked on Monday?
Her neck and chin.
Her neck and chin. So if you have a lot of loose skin, SmartLipo is not good for that. But if you have just some generalized fullness underneath your chin, SmartLipo can be a great way to define your jawline, to make you look more youthful. And I think that's something that's oftentimes overlooked in patients.
Right.
And so that's an area that can work really well. And Michelle, you have a question for us.
I do have a question, because I listened to you about all the different procedures, and so I think I know a little bit about how fat is, and it is in a certain a structure, right? Like when we talk about fat off the shelf, right? A different procedure.
Yes.
And so that the fat cells then build themselves into this structure. So when you're doing the SmartLipo, is that removing any of that structure, or is it just the fat cells themselves that are going away? Okay,
so Michelle's been working with us too long, so you're becoming a techno nerd here. So our fat is encased in fibrous tissue, and we oftentimes refer to it as a honeycomb system of fat. And so we're not actually injuring that honeycomb system. We're emulsifying the fat cells that are in the honeycomb cells, and we're suctioning that out. In fact, they did a beautiful, elegant study once where they did lipo on an area, and then they went in with an endoscope. So it's a scope you can put it in, fiber optics, and you can look at it on TV and record it. And when they went in, you could see the fibrous septi, or the honeycomb system, intact for the most part. You can see blood vessels and nerves intact. So that's the beauty of this procedure, is you're not cutting any of that tissue. Even though you may be watching myself and working with Karina, and we've got sweat on our brow because we're going to town, really working to get that fat out of there. But it actually protects those structures, okay? So did I answer your question?
Yeah.
Okay, great. So that indeed is intact, and that's what's nice. One of the questions that I thought that Michelle might ask me was, okay, looking at the structures of this fat, we have 2 layers of fat, okay? And so Karina understands this. Right under the skin, and then in your muscles, right under the skin is a superficial layer of fat. We don't actually want to suction that area, because we don't want to leave you with the irregularities. We're suctioning the deeper layer of superficial fat, the deeper layer of the superficial fat. And by doing that, we can get a nice, even decrease in volume that is more homogeneous, versus if we're gets right underneath the skin, we can leave ourselves with some undulations or irregularities. So we specifically are targeting the lower layer of the superficial fat.
Awesome. I'm learning so much. I learn so much every time you come in.
Every time we come in, we talk about that. Is there anything that you might recommend to our patients, Karina, when they call in, or let's say, hey, I just heard Karina and Dr. Tom talk about they want to get a hold of us. Is there anything in particular that you might recommend to them when they go through this process?
No, just be prepared to send your photos. That's the most critical part. And then just don't be afraid to ask any questions. There's not such a thing as a silly question. And if I can't answer it, I'll get you.
Absolutely. And we've been doing this. We've done close to 1,000 of these procedures. And so, we understand your concerns. What I'd say, give us a call. We're more than happy to answer all your questions. You won't just be talking to me on virtual and then showing up for surgery. We will then arrange for you to come in for another hour with me, where we will sit and physically examine you, answer your questions. Karina has a whole host of things that she will go over with you, your pre and post-op instructions, to make it be a real positive experience so you get the best results you're looking for. So, Karina, thank you for being here. SmartLipo, done under logo using a laser to melt fat, tighten the skin, is a great way to contour your body. And I'm going to turn it back over now to Michelle.
Wow, I love this topic. I think it's so much fun to learn more about these procedures, so it makes it more approachable, I think, for your customers to feel comfortable about reaching out. And that's what you can do right now. You can reach out to Dr. Tom. He has offices in Santa Rosa, Napa, and Maui. You can also find him online at drtomcosmetic.com. You can read up about SmartLipo there. You can see those before and after pictures that are very inspiring. You can also call 707-542-8346. 707-542-8346. Make that call. Invest in yourself. This is what it's all about, right? And taking care of yourself and feeling better, having that better positive image. Thanks, Dr. Tom. Thanks, Karina. We'll see you next time.
Thank you, Michelle.
See you next time.
This is KSRO.